all the soothing medical ASMR. Now then, Kane, I think you're in a little bit of trouble, aren't you? Yes, I think you are. You foolishly came to me, didn't you, when I put my little advert out suggesting that who would love to know what it feels like to have a baby, be the first male to be inseminated, and there you were knocking at my door. I don't suppose you thought it would happen as quickly as this, did you? No. But once you're in my care, well, I'm afraid you really can't leave. Anyway, shall we begin with our first procedure today? Shall we? There you are. Just sit nice and comfortable for me. This is going to take a while. Now, as you can see, we are ready for the first procedure, but of course there's a few things I'm going to need to do first. So I will need to scrub up a little bit before we begin our procedure, because of course this is going to be a very long procedure. Very long indeed. They're my favourite, you know. When I say long, I mean from beginning to end, at least 9 months. You never know. Things might progress early. These things happen. It's not unheard of, you know, not at all. I'm just going to pop some gloves on for you. So, you were all too eager to answer my message, weren't you? Jumped straight in there, didn't you? Did you imagine that it meant you would be coming to stay with me? I don't suppose you did you? They rarely do. So foolish about these things, so foolish. Anyway, that's all right. I'm sure you'll enjoy this first part of the procedure. It's not so painful. I can't promise the rest of it won't be painful. But this bit, no pain at all. So you'll be fine, won't you? Won't you? I'm certain that you will be. Let's just pop a little cap on here. There we are. I'll just take some of that and pop it up behind. There we are. Don't want that disrupting us with our very important business, do we? Absolutely not. Right, we'll just tuck that over my ears a bit. Okay, I'm going to do a couple of quick checks on you. I don't want any accidents happening when we're working. So, if you can just pay attention to me, well done. I'd like you to follow the light, all right? There we are. If you can just follow the light for me. Are you ready? Okay, are you awake enough? Follow the light now. Follow it across. Well done. And to the other side. I'm just going to check your pupils. Just, that's it. Well done. Okay, no, we're all right there. Okay, how many fingers? Do you see? Well done. Coming up to the left. Look up to the left, please. Lovely. And up to the right. Excellent job. No problems there at all. Of course, before we begin any procedure, I certainly don't want any infections, so open up. That's it. Just popping that in there. Just going to hold that in there for you. How are you feeling? Are you all right? Do you feel nervous? Oh no, I'm sorry, the restraints were absolutely necessary. They were. You know, sometimes you might, halfway through a procedure, decide that, oh, that's lovely, well done, decide that actually you're not up for it anymore. And quite honestly, that can't happen. So, now I know, no infections, nothing to stop us going ahead with our lovely little procedure, is there? Well, you know what comes first, don't you? I expect you're ready for this. So I'm just going to open up your sheets a little there. We have it. Now don't worry yourself at all. I'll make sure there's plenty of anaesthetic in the area. I'm just going to pop this now down. I'm sure you can work out what's going in that little hole, can't you? Let's just put that in. There we are. It's going to get you comfortably out. Lovely. Very nice. Excellent. Now, let's just put a little bit of anaesthetic into the area. It's going to be around your scrotum, you will feel that, and at the base of the shaft, and that's very, very important because obviously we are going to need to take that away. You understood that, right? Absolutely, because we're going to be building you a beautiful womb. Yes, we are. You are going to have the most perfect womb to carry a child. You must be so excited. Really? So when you signed up for this, you didn't realise that that would be the procedure? That's what the restraints are for. It does happen sometimes that people decide, oh no, don't take it away, but unfortunately it's a necessary evil. Just going to give you a couple of little light injections. Alright, so we're just going to go in around the left quadrant. How are you feeling there? Alright, going to come in and around the top as well. That's it. Going in on the other side. This is quite delicate, this bit. I don't want to cause any additional excess pain. So it does happen and you'll just have to scream it out. But please don't worry. Nobody can hear you from here. No. No, no, no. I've taken you to my very special surgical room and nobody knows where this is. So there'll be no problem with anyone coming in to disrupt us, especially when you're growing that lovely little fetus. Now, I'm just going to give you a moment. Just relax. We just need that to work fully. It's vitally important that you're not anxious and stressed because that could dramatically affect the healing process. And in this case, we need the healing process to be just perfect, don't we? Now, let me have a little look. Just get a couple of new tools for you here. Oh, absolutely. I've been thoroughly looking forward to having you in for a little surgery. You can't imagine the excitement I've been feeling ever since I got you to sign those papers. Got you to just sign it all away. Right. Now, just going to poke you with my finger gently. I just want to know if you can feel that. No. What about here? No. And underneath? Nothing. Oh no, don't panic about that. Trust me. You'll be happy about that. Alright, I'm just going to go in with a few little snips around the edge. That's it. You're just here, snipping around the edge. That's it. The other side, just loosening it, don't worry. Of course I've done this before. Many times actually. They didn't all work, but mostly they did. I think we're going to need to go in with slightly bigger guns now. I've got a couple of different ones here. I'm just going to come in and just... No, don't worry yourself. You'll be fine. Right, just need a little snips around the... Oh, that's better. Then we can go in with the old bad boys. And really, it's quite a simple procedure from this point. Most of the veins have already been disattached. Alright, we'll just go in with the larger clippers. There we go. That's it, coming around the edging. Ooh, nearly fallen off in my hand there. There we go. Right, wonderful. I'm just going to, don't look. Probably best not to look at that point. Yeah, probably best not to look. Alright. Yeah, so just going to take my little needle. We're just going to suture and sear some of these edges. I'm just going to burn them in, which will heal a lot quicker. There you are. Right. Well, that looks pretty good to me. Looking lovely it is. Right. I think I'm going to let you have a little break because I've got a bit more digging and manoeuvring and rebuilding to do, you know, inside. And I think you probably should be out for that because it's going to be quite painful. Oh, it is. No, that's alright. If I can just bring this little tube in here, what I want you to do, don't panic. Just take some deep breaths for me. I'm going to be here the whole time, reconstructing you a beautiful womb. Take that in your mouth and breathe. Good work. Deep breaths, take in the gas, let it fill your lungs. You will want to be out for this one. There you go. 5, 4, 3, 2, and out. That's perfect. That's probably some of my best work so far. Let's take that away. Now, I think we're going to leave you to rest out. That's going to take a few months to just heal perfectly. And you're going to stay here with me, aren't you? While that's happening? Yes, that's what you need. To stay here with me. I'll take good care of you. Don't you worry yourself. Not one bit. Hello there, Kane. Hello. How are you doing? Are you all right? Good. I must say, I've been checking your chart, and you know, you've been doing exceptionally well. Yes, you have. I started you on the folic acid, and you've had no problems with that. You've been keeping your food down very well, although sometimes I do have to, you know, pop it through the saline, but that's all right. That's all right. Are you getting a bit bored? We haven't even started the pregnancy yet. You've got another 9 months to go. Oh, I see. You thought the procedure would be 9 months. No, I'm afraid not. It's taken you 3 whole months to recover properly for your beautiful womb to be perfect and ready for insemination. Are you ready to be inseminated? Are you? Good. I'm going to have to do a couple of gynecological checks first. So, let's open you up again. That is looking very perfect. Well done you for that marvellous bit of healing. Yes, I'm very impressed. Now, let's just have a look here. Oh, there she is. There she is, all ready and waiting. I'm going to have a quick pop on the light there. Okay. All right, now, I'm sure you're well acquainted with this lovely little tool, but this beautiful tool is going to very slowly open you up so that I can have a nice look down inside you. I'm going to take my little torch and pop it up there. All right. obviously being particularly kind today, I'm just going to pop a little bit of Instagel just there on the end. There we are. So that we can slide it in nicely. Now, are you excited? Because technically, this is the first time you've had anything slide in. I know. Are you ready? All right then. So we're just going to take it closed, fully closed at the moment with the Instagel on it. I'm just going to slip that in. You'll just feel it. Feel it just on the opening. Lovely. Sliding in a bit further. Oh, look at you all tingling. All right. Just going to begin the process of just opening you up now. You'll just feel, that's it, you'll just feel your insides being stretched very slightly. They've not been stretched before, have they? No. There we are. Right. That's a fantastic view. If you can just make sure you're staying very still for me. Very still indeed. Are we ready? Actually, I'm going to bring in a slightly stronger lamp. Let's bring in the medical lamp. All right, are you ready? You'll just see that lighting up the area. There we are. Oh, I say. That is wonderful. Looking very clear. Just going to take a quick swab. Just take a quick swab from in there. So you'll just feel a slight scraping. It's all right. All right. I'm going to just leave that there for a moment. I'm just going to pop that in a little specimen bag. There we are. I can just make sure that that's all clear for you. Right. Do you know? I think you could be ready. Do you think you are ready? Right, well, you just lay back there. All your dreams are going to come true. Right, Kane, are you ready for this? Okay, are you ready? All right, so we're going to start by lining the womb entrance with a little gel to just help it on its way, all right? So you're going to feel this. I'm going to push it in. All right, can you feel that? And that's actually going to go to the opening of your womb. You'll just feel me gently. There we are. It does feel a bit cool, you're correct. Don't worry. All right, that's that one done. Next, I do want to make sure that there's no tearing, no damage occurs when we do the insemination. So I'm also going to pop in a little Instagel and you'll feel me just gently lining you on the inside. There you are. That's it. Right, that's done. And now, if you can take a really big deep breath for me. Yep. The specimen we're using is already in some umbilical liquid, which we're going to pop in. There we are. Are you ready? Deep breath, please. Okay. And that is it. Okay. Right, I want these legs pushed up nice and high. That's it. Keep them bent up at a right angle. We want to make sure we give this little specimen every possible chance, don't we? Yes, we do. You've been such a good patient, taking all your folic acid and all the vitamins I've been giving you. I know you didn't really want to stay, and I do understand you didn't realise you were actually going to be kidnapped, but aren't you pleased now? Now you can see that the results will be coming very soon. We're going to close you up now. That's it, there we go. I'm just going to close you up fully. There we are. Right, we're just going to take that out. Okay there? There we are. We're just going to pop that over on the side. Let's get you all covered up again. There you are. Now, how does that feel? How does it feel to know that you are going to be a parent very soon? A parent, can you even believe it? I expect you can't, can you? How are you doing, Kane? Yep, day 57. You're getting there, aren't you? You really are getting there. Going to do a quick check for you. Let me have a little look. Let's have a little look-see down there. Oh, I see. All right. It's all looking perfect, you know. Everything's intact. You are getting a little bit of atrophy on those legs, aren't you? Perhaps we can do a little bit of physio on them with you being, you know, restrained here the whole time. Yeah, that's all right. I can do that for you. Don't you worry. As I said, all your needs will be catered to. Of course they will. There you are. There you are. Let me rub you. Let me rub you. I tell you what. Shall we get you rolled over and I can give you a little back rub? Yes, that's it. I'll just release one of the restraints for you. Let's have a look, shall we? I'll just take this one over and then perhaps we can get you to... Oh, there you are. There you are. There you are. Now, let me just rub your back for you. Well, I've got you in this perfect position. I'm going to do a little check on your chest. So you just lay there. I'm going to just pop that on. Just going to hold it there. Take some deep breaths for me. Are you ready? Breathe in deeply now. Good job. Breathe out. All right, let's check the other side. Wonderful. Everything's perfect there. Nice and clear lungs. Let me just rub your back a little more for you. Does that feel better? I bet it does, doesn't it? Feeling my gloved hands just massaging your back for you. Oh, I bet you've been dreaming of this. And I don't usually do this for my patients, but as you've managed to get so far in the pregnancy, well, of course it had to be done. Of course it did. Right. I'm going to get you all back into position because I don't think you've got much longer. Won't it be marvellous when we get your little baby out? Oh. Are you scared? You should be a little. It's quite painful, you know. Child labour. Yes, it's taken out some of the strongest women, so as for you having a go at it, well, who knows what's going to happen? Hey, who knows what's going to happen? But I'm going to get myself prepared now for labour. How are you feeling today? It's a very exciting day for you, Kane, isn't it? So how are you feeling? Are you ready for this? Well, you should be. It's going to be a marvellous day for us both. And hopefully you'll survive, but who knows? Can't always tell these things, I'm afraid. It's not always possible to know the outcomes, as I'm sure I've explained to you. You know, some of the greatest women alive have been taken down by this, so child labour can be so complicated. So complicated. But it's all right, because you've got me here to help you deliver, your very own personal midwife. So, you're going to be fine, aren't you? In fact, I would suggest you could even get a little excited. Now, I know we've spoken very much about what's about to happen to you,
And I appreciate that you understand it is going to be exceptionally painful, but that's childbirth. What can we say? If it really does get too much, I can offer a little bit of gas and air, but honestly, I'd love to see you do it naturally. I just want to watch you do it naturally. That's what I'm looking forward to. Now, shall we have a little check? I know that when I checked in on you before, the contractions were coming around 6 minutes. So, let's have a look at the chart and see where we're up to now. Oh, that's come down to 4.5 minutes. Oh, well, this is getting exciting. Oh, don't scream. I know it's a bit painful, but those contractions will just come in waves. And what do we do when they come in waves? What do they do? That's right. Shallow, small breaths. Try it with me now. Well done. You can even add a oosa onto the end if you wish. Oosa. That's it. Well done. I'm just going to pop a finger in. I just want to have a little feel around and check myself manually where we're up to. Are you all right? Okay. Just one finger's going to go in now. You are. I'm just going to have a little feel about in there. Wonderful. You're opening. Just perfect. I'm just going to pop 2 in because I want to make sure that we're encouraging you to open up, as you're not naturally designed for this, are you? So I'm just going to give you a little massage in there. Make sure that you are opening up nicely. Preparation's all we need. Oh, here comes one of those contractions. Well done, you. Well done. That's it. Just take deep breaths with me. Breathing in slowly. Oh, another contraction already. We really are making our way now, aren't we? Breathe for me. Shallow breaths. Well done. Well done. You're doing all right. That's it. Just going to take a little look down there for a moment. You're very, very near now. Very near. I'm just going to have a little look down there. Oh my goodness. I can see baby's head coming into play. Oh, push for me. Push for me now. Now's the time. Knees back. Well done. Deep breath. Push from the sternum, please. Don't push from lower down. Push from the sternum. Push. And again. Push. Come on, keep going now. Push. Well done. One more. Push. All right. We are nearly there. Head starting to crown. Okay. Are you ready? Don't you worry. Baby's coming now. And you've done really well so far. So keep that up for me. All right. I'm going in, sweetheart. I may use my hands just... Do you know? Baby's starting to crown, but you're not quite there yet. I'm afraid we're going to have to give you a couple of snips. Don't worry, it's all perfectly normal. Just going to go in where the rectum is and at the top. Just loosening. That's it. That's it. Don't scream. Baby will be out any second. It's just crowning. Come on then. Come on then. You can do it. I know it's spreading every inch of you apart. You may feel you're not going to survive, but you will. Come on. Come on then. Come on then. And any minute now you're going to feel a release. Oh. Well done. Hello you. Hello you. Shall we just turn you over and give you a little pat? Don't worry. It's quite normal. I just need to give you a little pat and warm you up a bit. There you are. And you've got a lovely little... It's a little boy. How wonderful. Aren't you beautiful? Now, You better rest up there. You're going to need to get your strength up. Because I want a whole family of children. And, well, no point waiting. We should get you pregnant again as soon as possible. Shouldn't we? Your little Bubsy, you rest there, between Daddy's legs. Yes, you're just beautiful. And so are you. And I can't wait for the next pregnancy. Oh, happy listening, my darling. Hello there. Thank you so much for listening today, and I hope that you've enjoyed. I wanted to just let you know I do actually have 3 channels. One is a leather and latex tingles. You'll get interesting funny stories as well as latex glove content, lots of glove content. I also have a medical channel, and obviously I have my Sleep Easy channel. So I'll pop all the links in the description below just in case you fancy trying some of my other ASMR. And you can always pop over to my Patreon page for additional content as well as my OnlyFans. Happy listening, my darlings.